likely. Newly released federal data shows African American and Latinx people are nearly 3 times more likely to be infected and twice as likely to die from the virus compared to their white neighbors. If you can talk about the disparities, who lives, who dies, and who gets sick and who doesn't.
Sure. I think that, before the pandemic, what that people may not realize is that there were pretty significant racial health disparities in this country. I think many people had heard about the Black maternal mortality crisis that had gotten a lot of press. But what we saw in the pandemic these first few months is these really significant racial health inequities being exposed and even amplified. We saw that, Black and Latinx and Indigenous communities were more likely to be infected because they were essentially placed at risk given the types of jobs that they had. They were more likely to be essential workers and service workers. These were public-facing jobs. They were essentially exposed. They were also more likely to use public transportation in urban areas, and more likely to live in overcrowded housing. These are all risk factors for being infected with the disease. And then to think about which communities carry the highest burden of chronic diseases, diabetes, high blood pressure, obesity, and asthma are all risk factors for doing very poorly when you are infected with coronavirus. And so those are some of the factors for why we're seeing Black, Latinx, and Indigenous communities being so disproportionately impacted by this pandemic.
Dr. Blackstock, I'd like to ask you specifically in terms of some of the figures I've seen in terms of the Latino community. For instance, here in New Jersey, 19% of the population, 30% of the COVID cases. In Utah, 14% of the population, 42% of the COVID cases. This whole issue, because the Latino community, generally speaking, is a much younger community than either the African American or the white community. So you would the proportion that are elderly are much smaller. Is this more a function of the underlying conditions that affect the community, for instance, diabetes and other underlying conditions in the community? Or is this, what other factors do you see affecting the Latino rate?
Right. And so, as I mentioned, I think, when we talk about who is at risk for being infected, it also depends on who is at risk for being exposed. And so, I think that those numbers that you cite point to the fact that Latino community members are more likely to be working in jobs where they're at risk for being exposed. And of course, this is because of practices and policies that limit certain racial groups to certain types of jobs. And so I think that what we're seeing really are the outcomes of structural racism in this country. We have seen how life opportunities, including job opportunities, educational opportunities, have basically limited people and put people at risk to being in situations where they are more likely to be infected with coronavirus. And what I found very interesting about the New York Times piece was that we're not just seeing it in urban areas, we're seeing it in rural areas, right? So I would say that speaks to the expansive reach of racism in this country.
But for me, it's a metaphor that shows what's happening in Indian country right now. Tribes, rural reservations and villages, urban Indian communities, we are seeing our people suffer and we are seeing our people die. And we are not getting what we need in order to serve them well. Our Native people are not being counted in the health data as Native. That means they're being counted as another race instead of as American Indian or Alaska Native for a couple of reasons. The number one being nobody ever asked them. They simply took a look at them and identified what they thought, whatever race they might be, instead of actually asking them. In other places, there may not even be a category in those data systems for American Indian or Alaska Native. And in fact, they'll be counted in a group called Other. And if you're not collecting that racial data, policymakers are not getting the correct information that they need in order to allocate resources and in order to understand where and how we can prevent the spread of COVID in the future. Government, states and counties who want to swoop in and save us, that's not how it's happening. And when they do that and they attempt to push us out of the way or not get us the resources that we need, what we have seen is that those resources never reach the people they were intended for.